Hello everybody, I'm back again, Dr. Jaishree Sharad, your skin expert. I have with me today a beautiful 15-year-old Kritika who has loads of skin queries to ask me. Stay tuned. So Kritika, tell me, how are you?
I'm fine, how are you?
Very good, thank you.
I'm so glad to be here to ask you some of the questions that have always been on my mind.
Tell me.
Okay, so as a teenager, all my friends and me, we always have this trouble of getting blackheads or whiteheads on our face. Some of them suggest me to use aloe vera gel, some of them tell me to use nose strips. So what do you think is the best way to take care of the blackheads and the whiteheads?
Oh, it's a very good question. It's such a common thing, isn't it? I mean, girls, boys, everybody. So the first thing that you must do is make sure you use a good cleanser. So you can use something like Cetaphil cleansing lotion, or you can use a salicylic acid based cleansing lotion. Make sure you don't, sit and break all your blackheads and squeeze them out. I've seen a lot of people doing that all the time, and you sort of get irritated with them, or what is it? I mean, why are you girls always trying to sort of taking those blackheads
Basically,
out?
we don't want to look ugly.
Don't you realize when you're squeezing that out, you're actually making yourself more ugly? Because what is happening is, it's getting infected and you'll develop bacteria, they'll turn into big pus boils. You're also damaging the skin, so you end up with a black spot there. It's a blemish, and then you have to treat that blemish. So don't touch them, and be very careful about what you're eating. So cheese, chocolates, pizzas, burgers, ice creams, pastries are out. You have to have a lot of fruits, vegetables, eat healthy. It's important. These nose strips that you're talking about, Kritika, they are very temporary and sometimes they may even damage your skin. So don't do that. Aloe vera is a good option. You can use aloe vera. You can make a paste of neem, neem leaves. Just make a paste and apply that if you want to do home remedies.
Okay.
And otherwise, it's best to consult a doctor.
That is you.
Yeah. Oh, thank you.
Okay, doc. So do you think facials and cleanups is a good option?
No, facials definitely not. You're just 15, and facials is something that one would do after the age of 40. It's more like a feel-good factor. Remember that when you're massaging your face like that, you're actually stimulating the oil glands to secrete more oil, and then you'll get more pus boils, more pimples, more blackheads, more whiteheads. So definitely no facials for you. You can certainly go and do cleanups, but make sure you go to a proper skin clinic and a place which is really hygienic, and the instrument has to be sterilized, it has to be put in an autoclave machine. You can't just boil the instrument and just do something. So it's very important as to where you're doing the cleanup from. And mind you, it's not a bad idea to treat acne. So if your dermatologist is giving you pills and some creams to use, you can use them, because you're going to prevent scars. Because a lot of times people feel, oh, I'm 15 and it's a teenage thing and it's normal. It's not normal. You don't want those pits, right? So it's best to get yourself treated. Over the counter, of course, there are a lot of brands which have benzoyl peroxide and clindamycin. You can pick them up and you can use them at night. So your blackheads and whiteheads will reduce.
Okay, Dr. J, I love applying makeup. I love applying makeup too whenever I go to parties or movies or anywhere. So so am I allowed to do that?
As a 15-year-old, I would say you should restrict yourself to cleansing your face twice a day, using a sunscreen in the morning, using a moisturizer at night. As far as makeup is concerned, just use lactocalamine or use a like a BB cream or something. A little blush and eye and lipstick. Don't do something very heavy. Don't use concealers and foundations and all that jazz. So keep it simple.
It's winter. My lips get so chapped. I don't know anything to do about it other than applying a chapstick. So what do you suggest?
So the first important thing is don't purse your lips and don't lick your lips. So this and this both will cause more dryness. What will happen is the saliva which is there, it's going to cause more chapping and cracking of the lips. Okay, so that's the first rule. No lip licking. Okay. The second rule is that there are a lot of these lip balms which are flavored and fruity and they taste good, they smell good, but they're actually not very good for the lips. So you have to stick to these medicated lip balms, and you can apply them any number of times. What you can also do is take a little bit of ghee or take a little bit of butter. Don't eat it, just apply it on the lip and leave it on. that's really good. If you are using any kind of lipsticks and lip glosses, etc., make sure they're not matte. Use something which is more hydrating, more moisturizing. Look for something which has an SPF in it. That's the best thing to do. Once in a week, what you can do is take a little bit of sugar and honey, make a paste and just rub it on the lips. So you're just gently exfoliating the lips and then apply your balm. Okay, but the golden rule is no lip licking.
I have recently started waxing and it is so painful. So can I do laser?
Well, at 15, I would say wait for a bit. Normally I say wait for 3 years after you start your menstrual cycles, because the hormones are just setting in. You can start laser, but you don't know how many sessions you would do. Okay, so if you wait till say you're 17, 18 and then do it, you would need about 10 sessions, and it's very, very safe. But that's the best thing to do. As far as waxing is concerned now, every time you wax, make sure they're using those cellophane strips. Make sure the wax is not really old. It should not be more than 3 months old. Go to a hygienic place, and immediately after waxing, you must apply an antibacterial cream. What happens sometimes, you get those pus-filled boils, not the day of waxing or the day after, but the bacteria breeding in, and you'll get it a week later. And you can't even correlate, but it's actually the waxing.
Yes.
So if you really take care, it won't be a problem. And 2 years later, you can just go ahead and do the laser. Yeah. Thank you, Kritika, for coming and taking all the trouble. Such a pleasure to have you.
No, thank you so much for answering all my queries.
My pleasure. Subscribe to Skinfiniti, post your comments here, and do share this video if you like it. Stay blessed.